Imagine needing a quick, effective way to prevent pregnancy after an unexpected situation. You're not alone. Many people turn to emergency contraception, EC, when things don't go as planned. But there's confusion about how often it can be taken, what side effects to expect, and how effective it really is. Here's what you need to know to make informed choices and protect yourself. Section 1. The Basics of Emergency Contraception, EC. Emergency contraception isn't new, but there are still misconceptions. EC pills work by delaying or preventing ovulation. In simple terms, they stop the egg from being released, so there's nothing for sperm to fertilize. If ovulation has already occurred, EC won't work. It's not an abortion pill, it won't affect an existing pregnancy. Types of EC pills: levonorgestrel, Plan B, a progestin-only pill, available over the counter. Must be taken within 72 hours for best results. Ulipristal acetate, ELA, a selective progesterone receptor modulator that blocks progesterone. Requires a prescription and can be taken up to 120 hours, 5 days, after unprotected sex. Combined estrogen-progestin pills, these are higher doses of regular birth control pills, used off-label for emergency purposes. Section 2. How often can you take EC pills? Let's get one myth out of the way: there's no strict limit to how many times you can take Plan B or its generics within a menstrual cycle. But just because you can doesn't mean you should rely on it as regular birth control. Why? It's simply not as effective as other contraceptive methods. Regular use could lead to more unintended pregnancies compared to daily birth control pills or IUDs. With ELA, there's a different rule. You should only take it once per menstrual cycle. Why? It's not well studied for repeated use within the same cycle, and combining it with other forms of EC like Plan B could make both less effective. Key takeaway: while frequent use of Plan B isn't linked to long-term health issues, the most significant risk is pregnancy due to reduced effectiveness over time. Section 3. Real talk about side effects. Taking EC pills can come with side effects. The good news? These are typically short-term. Here's what to expect: nausea and vomiting. Plan B and other progestin-only pills might make your stomach churn, but this usually fades in a day or two. Fatigue and headaches. Feeling wiped out or getting headaches is common, but temporary. Menstrual changes. Don't be surprised if your period is a week late, comes early, or is heavier than usual. This is normal and only affects the cycle immediately following your dose. Lower abdominal pain. Some cramping might happen, but it's not severe. Pro tip: if your period is more than a week late after taking EC, take a pregnancy test. This step is crucial to rule out pregnancy. Section 4. The cost of relying on EC. Here's the reality check: emergency contraception can be expensive. Plan B typically costs between $25 and $60 per dose, and ELA starts at around $50 and up. Compare this with the price of birth control pills, which are often cheaper and more effective in the long run. Is it worth it? Yes, in emergencies, but EC isn't budget-friendly as a primary birth control method. Investing in other forms of contraception can save money and stress in the long term. Section 5. Common misconceptions, busting the myths. 1. EC pills cause infertility. False. EC pills don't impact long-term fertility. They only work by temporarily delaying ovulation and don't affect future reproductive health. 2. Taking multiple doses boosts effectiveness. No. Taking extra doses of Plan B or ELA within the same incident won't improve its efficacy and can lead to unnecessary side effects. Stick to the recommended dose unless instructed otherwise by a healthcare provider. 3. It's the same as an abortion pill. Absolutely not. Emergency contraception prevents pregnancy from happening, it doesn't terminate one. Section 6. Safety, effectiveness, and expert advice. The safety of EC pills is backed by science. According to a 2019 review, those who use emergency contraception frequently may have a 20 to 35% chance of pregnancy over a year. This number highlights why it's essential to consider more consistent contraception methods for regular use. Plan B versus Ella. Ella is generally more effective, especially closer to the 5-day mark after unprotected sex. However, taking Ella means avoiding other progestin-based contraceptives for at least 5 days due to possible interactions. For any concerns, consult with a healthcare provider or pharmacist. They can provide tailored advice and explain which option suits your needs best. Section 7. Navigating the post-EC phase. You've taken the EC pill. Now what? Be prepared for possible spotting, fatigue, or a delayed period. If your period hasn't arrived within a week of its expected date, take a pregnancy test. This precaution confirms the EC worked as intended. Plan ahead. Consider setting up an appointment with your doctor to discuss long-term contraception. Emergency contraception is a safety net, not the main plan. Reliable options like IUDs, the patch, or birth control pills provide better ongoing protection. Conclusion: take charge of your choices. Emergency contraception is an empowering tool that offers peace of mind in uncertain moments. Knowing the facts, how often you can take it, what to expect, and what myths to ignore, helps you make confident decisions. Remember, Plan B and other EC pills are there when you need them, but understanding their limits and side effects ensures you use them wisely. Have questions or concerns? Don't hesitate to reach out to a healthcare provider for reliable, personalized information. Your health and peace of mind are worth it.